Street briefing. Let's go to India now, which remains in lockdown after the latest extension was approved on Sunday. The country went into lockdown on the 24th of March, and schools, public transport and most businesses have been shut since. The world's largest lockdown, covering something like 1.3 billion people, does appear to have helped keep India's numbers relatively low, with a little over 3,000 deaths and around 96,500 confirmed cases. Now, in the southern state of Kerala, which has a population of 35 million, just 601 cases have been confirmed and only 4 deaths. Now, of course, the actual number of cases may be higher, but the state's health minister, K.K. Shailaja, has been praised for her ministry's rapid response to the outbreak. And we can speak to K.K. Shailaja now, Minister of Health and Social Welfare of Kerala State. So, as I said, there are only 4 deaths in a population of 35 million. That is pretty remarkable. How have you done it? Because you had a system of track and trace very, very early on, after the first word came through from China about coronavirus back in January.
Yes, we started our preparedness very early. As you said, our population is very high and population density is also very high in Kerala. But the Human Development Index is so high because we started earlier. We are focusing on social welfare issues and decentralized planning like that. Our local self-governments were very strong, and we have very good healthcare system in grassroots level. Public health system. We have in each and every panchayat we have primary health centers, we have secondary and tertiary health centers also. We have very good medical colleges and very good medical college hospitals in tertiary level. And we are now focusing on primary care and prevention. We are giving continuous training to our healthcare professionals and healthcare workers, refreshment trainings also. And when we heard about the new virus, we started our preparation from top level to bottom level. We are teaching the people how this virus will behave and what precaution we have to take when the virus come to our place. And all the peoples were aware of that thing before it came to Kerala. But it is not easy to educate all the people, and it is not easy to keep the people in quarantine in their own home or in a government created isolation center, quarantine center. We have to entrust healthcare workers and police and local self-government workers and people's representatives to make it sure that the people are staying inside the home. And we also prepared reverse quarantine activities also. And we started some break the chain campaign and also known as SMS campaign, that using soap and hand wash, and also using masks. All the population should wear masks when they go outside.
So just to interrupt you for a moment, I mean, you obviously you acted very fast with commendable speed. Do you think other countries around the world should maybe learn lessons from the speed that you acted on? Because you were taking some of these measures and having meetings just a few days after you first heard about what had happened in China.
Yes, we started these things when it happened in China, January itself. When we heard about the virus, we started our preparedness here, and we have very good correlation and coordination of the old systems of medicine, not only the modern system and also this indigenous system of medicine. And also we have a very good private health system here, and we have very good coordination on public health and private health system. And we convened a meeting with the private healthcare holders, and they also participated in containing this virus. And we give trainings to private healthcare system. We give trainings to them also. With the coordination of all these systems together, we formed a very good method of containing this to prevent the spreading, to flattening the curve. We worked hard throughout these days. We are working hard.
All right.
And that
All right. Thank you,
lockdown-
Minister. Sorry, we're just running out of time, but thank you very much indeed for explaining what you've been doing there in the Indian state of Kerala. That's K. Shailaja, Minister of Health and Social Welfare for Kerala State. Many thanks.